Hello and welcome to our brand new series, the Impact Initiative Live. We are so thankful to have you join us. In this series, we'll be bringing you timely topics, exciting guests, and key insights that we've learned from over 30 years in healthcare, including today's topic, RCM for today's challenges, and tomorrow's goals with special guest Christine Stetler. Christine is a registered nurse and AVP of Solution Engineering here at Medi. She is passionate about bringing innovation in healthcare data and technology directly to those who need it most to help them live their best and healthiest lives. With over 2 decades in the field, Christine has helped patients and fellow clinicians both directly, hands-on, and through technology. She has learned how to see healthcare through the eyes of varied stakeholders, giving her the unique ability to recognize gaps and close them. She is such an inspiration to me and everyone she meets. Christine, thank you so much for joining us today.
Karen, thank you so much. And right back at you. Thank you for inspiring me to be better and to share this, because we definitely need to get this out. So thank you for the opportunity.
Of course. Well, let's start with the big question today. It feels like value-based care is everywhere. Even walking the floor at HIMSS, that was a major theme. As someone who knows this area of healthcare so well, how have your conversations with clients and colleagues changed when talking about revenue cycle? What are you seeing in the industry right now?
Value-based care is most definitely at the forefront of many healthcare executives' minds. There's not many conversations we're having where that is not, even if it's not the main topic, it is definitely peppered in. Over the better part of the last decade, we've been seeing increase in shared savings programs through Medicare, and that was sort of like the catalyst and the crosswalk to value-based care. It's concerning for some of us, and then also exciting, and I'll explain that. The concern is justified, as we have to get our arms around cost. That's absolutely beyond a shadow of a doubt. That has to be done. We have to get that. So the value-based care model, and I want to absolutely reiterate, model is very straightforward in its endeavor. The belief, and I hold true to this as a nurse, is that the healthier we keep a patient, the less costly they are. The less that they need to boomerang back into the hospital, the less that they need to show up at the emergency room for something that was unexpected. It's ensuring that you keep your patient population seen during preventative visit times, that you're taking full advantage of those times, making sure that you are getting a plan of care that is agreeable to the patient, so they'll follow it, and that you have your arms around it. RCM execs want to get a handle on that now. Are patients coming in for their preventive visits? Am I tracking my patients to quality measures? Do I have the appropriate follow-up in place? And do I have the appropriate tools, not only to see how I'm tracking, but to give the appropriate insights to help me course correct if I'm not?
Love that. Absolutely. So while the industry is moving to value-based care, fee-for-service it's still there. Providers continue to need solutions to help them in this area. What are a few things that providers can do now to ensure that they're set up for success with value-based care?
It is absolutely understanding the cost of care in the here and now and improving the quality of care to your patient population. It's absolutely essential. For example, you could have a high population of type 2 diabetes, and that is me like saying sky is blue, water's wet, grass is green. Many areas of the country, you're not really going to escape a high evidence of type 2 diabetes. The thing is that type 2 diabetes is something that we can help control. So what does the cost of care look like for that population? What do your quality measures look like? What do their hemoglobin A1Cs look like? Do you have programs in place like diabetic self-care classes, nutrition referrals, and are you tracking those to make sure that you are getting your arms around things that will decrease the cost of that? And that would be true with any chronic condition that you want to look at. And again, and I'm just repeating myself because it bears repeating, the preventive visits. It's so important to get people in so that you are checking in with them, seeing what's going on. Organizations can show quality outcomes will be as they show their quality, they'll become the go-to organizations, because one of the things that folks will do to mitigate some of the burden of moving to value-based care is increasing the population of patients. The population of patients start to increase and people start to come to you when you are showing that you have true quality, that you're taking care of your patients, that they're a healthier population. Then you become attractive to everybody. You become attractive to large employers. So it's the need to know what's going on in your RCM population with your patient population. It's being fastidious about knowing and tracking the cost of care in your fee-for-service contracts. Be laser focused again on prevention and recovery. And that's not just prevention and recovery of patients, that's prevention and recovery of denied claims in your fee-for-service market. So that's a twofold sort of thing in prevention and recovery. Those words fit well into many things that you need to do. And then also know what the landscape looks like and have a strategy to mitigate. This includes having tools that show you exactly where your measures are successful and where you may need additional strategies. And again, that ability to course correct correctly and efficiently and quickly when you are starting to see something go off kilter.
Absolutely. And I'm sure a lot of that is a lot easier said than done. Now, you've worked with a lot of clients showing how they can gain insight into their revenue cycle performance. What are some of the recurring challenges that you continue to see where providers are typically struggling?
Literally just this past year, and you know that I read a lot. I have the nickname here at Medi, nosy by nature. It served me well as a nurse. It serves me well in RCM, and it serves me well for our clients. There was an article that I think few would believe that the title of it, but it was literally "Denials Are Getting Weirder and Weirder." That was the title of it, and it could not be more aptly titled. And you saw that part of the ROI strategy that I did here at Medi was digging through 5 years of data and just looking over what the denials landscape look at and what I'm now lovingly calling vintage data. I would love to say that I coined that phrase that was picked up from a potential client, but I loved it and I think I'm going to use it, may put it on a t-shirt. So being able to look across what was going on in the years. So in addition to looking at that, it was just so incredible to see certain denials that were being mitigated, certain ones that were not presenting as regularly as they did before. And I think it's because they are definitely under more scrutiny. But what wound up popping up was what one of our, actually an old friend of mine that I worked with previously and is looking to become a potential partner slash client of Medi, said it's a whack-a-mole strategy. Because literally as people were getting into looking at what was going on with timely filing and trying to look at some of the pre-cert denials, there were other denials that were just bubbling up. And even though they had very, very successful strategies at mitigating some of the denials, not being able to see what was bubbling up behind them. I hate to get horror movie-ish, but it's almost like the boogeyman underneath the bed is now just bubbling up, and you were just like fighting so hard against this one enemy, and one was lurking and you just didn't know. That's why it's so critical to have the insights. Clients need to have a clear line of sight into their current AR, understand their payer mix, how the payers are paying, have a self-pay and point of service collection plan, and do as much to prevent denials as possible, while also having a very streamlined, systematic approach to chasing and recovering denials that are actionable and ones that are actually leaving dollars on the table. We've talked about that, easier said than done, but that's why we do the research that we do here at Medi, just so we can get to those very finite details.
Absolutely. That is just so interesting. I want to dig in a little bit on your work and really in this denials management, this project that you're talking about here. Some very cool research that you've seen in your work with clients. Tell us a bit more about this data you've been digging into and how specifically are you helping clients make a big impact by closing maybe a very specific key gap?
Um, Medi has given me the awesome opportunity to lead rapid cycle development, which is going to lead into that. A little bit more about rapid cycle development is we garner so much data here at Medi. As you said, we have 30 years in this industry. We are bringing in standard data sets and also some not so standard data sets. We also amalgamate them to just bring up and surface very critical insights where you can very succinctly, accurately go after what you should. So garnering that much data, we surfaced it in a myriad of ways, gave us an opportunity to start to develop tools and reporting quickly without disrupting what we already have in our product life cycle. That's very important. If people are not accustomed to what product life cycle looks like, there are a lot of challenges to make sure that you're developing on a solution that already has grassroots, that's already moving. But if you can take a team and take the data that is already there and start to surface insights that maybe are just not as quickly seen or maybe aren't as obvious. The team in this rapid cycle development has worked on insights into GLP-1s, into air ambulance, and then into, I lovingly called it Project Whack-A-Mole. That's what I know that you're smiling about. That denials project quickly gives organizations intel into those denials that are actionable and also where money is being left on the table, because just because something is actionable doesn't mean that you want to act on it, which I know sounds counterintuitive. But depending on what a facility is getting back and expected reimbursement, it starts to, you start to get a level set of where you want to put your action towards it. Because if there's only a minuscule amount of dollars being left on the table, you definitely want to chase the ones where there's a lot more dollars that will start to push your revenue in a much better direction than maybe just chasing pennies. That's just important.
Absolutely. Do you think you could show us a little bit of some of the things that
Oh,
you're working on?
you know, I love a good show and tell. I would absolutely love to do that. All right. From this screen that I'm hoping you're seeing bright and clear now, um, definitely lends itself to my nosy by nature nickname. So going across the top, I didn't name this Project Whack-A-Mole. I'm sure that our clients will be very happy. But if they would like me to title it Project Whack-A-Mole, I can actually edit that so it truly says that. This was going after charges that were actionable against expected reimbursement, but also looking at charges that were denials that were avoidable. Because again, it's a bifurcated strategy. Yes, you need to know the ones that are worth chasing so that you are putting your brilliant manpower in the right direction, but you also want to take the brilliance of your folks that know patient access so well and start to mitigate some of those denials that were avoidable coming in just by putting in new processes, different ways of looking at it. But being able to get down to very granular data is so important. So here you'll see that I am looking at total charges, and this is just in our demo OU. So you can see that I am really good at naming my demo data, group 0 through group 9. Again, it's protecting the innocent. So I'm fine with naming it something as just commonplace as group 0 through group 9. I have the tiles in front of me that immediately give me what I need to see, where my denials are, what my expected reimbursement was. My denial categorizations that you can see over on the right-hand side. I am a big proponent of donut graphs and pie charts. The circles just seem to speak to me in a way that maybe others have bar charts, but I did not leave out some of our great graphs where we actually start to see this top 5 avoidable denials by denial amounts. So this was ones that you could chase by putting different processes in place to avoid those. And then you have your actionable, and then you have it by dollar amount very quickly and easily to see exactly which group was the highest, and also in the specific denial categorization. You have additional features here that you can look at down to the actual what was my denial code and the remark codes that I want to work at, because a lot of these require you to have the remark code so that you can look into specifically what needs to be done to mitigate that denial. In addition, there's tabs here. I talked about the avoidable denials as well as the actionable denials. So I can go into those very specific elements to be able to see these. And with this type of dashboard, you can take different pieces of this, give this to different folks so that the folks who are looking to work on the avoidable denials, they have that tab. And then as far as actionable denials, we have a tab for that as well. So you can go into those individual facilities. So that's a little bit about Project Whack-A-Mole.
Thank you so much for showing that. So Christine, if you could recommend one thing that providers should do now, what would it be and why?
Get acquainted with your data. I can almost guarantee that you are going to find some gaps, at least some gaps, and you may find a lot of gaps. Show yourself and your organization grace, but be sure to pair that with the grit to stay the course, because there are going to be things that you're going to uncover that are going to be like, I can't believe I didn't see that before. And it's very easy to get frustrated. Frustration does not get you anywhere. One of our great solution engineers who I adore, and I know that you do too, Jennifer, she's a Michigander. I think that's how you pronounce it, a Michigander. She says something very different than what I grew up hearing as a Philadelphia girl. And it's called the get your poop in a group. So in other words, get acquainted with your data, make sure that you know what is actionable, what is avoidable, know what your contracts look like, know how your payers are paying now. Your shared savings programs, you want to make sure that you've got processes in place, whether it is looking at your how you're looking at your chronic conditions and making sure that you're getting your Medicare population in for that. All of those things right now are just so important. You have to have also the courage to realize that you don't know everything and to ask for help. I hear this regularly, and I don't know if it's just the universe just trying to tell me something, or maybe folks just passing on really wise and sage advice. And that is the greatest courage that you can show, is to ask for help. And this is something that we love to do with our partners, is that we get such great insights from them to know what they are facing, and we learn from them every day. We are really good and well poised to dig into data so we can surface things that they need to know right now. So again, get acquainted with your data and get some programs in place. Show yourself grace, but definitely exert a lot of grit to make sure that you stay the course.
I love that. Shout out to Jennifer. That was an amazing soundbite. Thank you for that. I love that so much. Jennifer is amazing. So fully agree with you there. So that was amazing. Jennifer, shout out to you. All right. Well, we have reached our lightning round. So if you are up for it, Christine, we're going to do a quick Q&A session. We got 3 questions, and the goal is to answer them as quickly as possible. So if you're ready.
I'm ready.
Right. So for the lightning round, what is one thing in healthcare that has you really excited right now?
There's never one thing, but I will wrap it around this, and that is the near constant innovation. Everything from that I've been tracking with the GLP-1s, Da Vinci robotic surgical systems, the Misha knee system. But what's equally exciting to me is a patient becoming the consumer. People are becoming more of a partner in their care. They want optimal health, and they want to plan to get there. So all of that together is exciting. The innovation of what medicine brings forward, but more of an innovation of patients becoming a consumer and really wanting to be a partner in their plan of care. That's awesome.
I love that. And if you could solve one major challenge for healthcare organizations, what would it be?
So this should definitely be my t-shirt. And I've said this since joining Medi, and really more coming into the business side of medicine, that I wholeheartedly believe that more dollars should go towards the care of patient and the research to care for patients than the administrative chase of a payment. And whatever I can do to march that forward, I am 100% there.
Love that. What is one key trend that you're keeping an eye on? Anything we should be watching and researching?
So it's not new, but it's something I've been excited about even pre-pandemic. And I think you know this from our previous lives, and that is telemedicine, extending our ability to care for people where they are at, regardless of time of day of week, zip code. Communication is such an essential piece to greater health. And whatever we can do to decrease the cost and meet patients wherever they're at to be able to extend care, I think that that is something that is beyond exciting and something that needs to continue to develop.
I love that. I love that. Well, that concludes our lightning round. Thank you, Christine, for playing our lightning round and also for this amazing interview. Is there any final words of advice or insights that you'd like to share today?
I would love to keep this dialogue going. I so welcome the LinkedIn world and those beyond LinkedIn listening to this to reach out to hear us at Medi. Let's keep communicating and let us help each other navigate what's coming ahead.
Thank you, Christine. Amazing.
Thanks, Karen.
Thank you so much for joining us for this episode of the Impact Initiative Live on LinkedIn. If you have additional questions, just like Christine said, or you're watching this at a later time, please let us know in the chat and we'd be happy to connect with you after the live. And if you haven't already, please be sure to follow us on the MedeAnalytics LinkedIn page to stay up to date on all of our great thought leadership from the likes of Christine and Jennifer and others on our team. And of course, more conversations right here on LinkedIn Live. We'll be back with another great episode, this time talking about explainable AI in a couple of weeks, and you won't want to miss it. Registration will be live very soon. Thank you again for joining us. We'll see you next time.